Have you ever woken up in the morning and felt like something was sitting right here in your throat? You cough, you clear your throat, you swallow again and again, you drink tea, you try to force it out, but the mucus does not move. And after a while, you start wondering, is this my lungs? Is this a cold? Is this something serious? Don't panic, but don't ignore it, because after 60, that constant mucus feeling in the throat is not always just a cold. In fact, many seniors keep treating it like a chest problem when the real cause may be coming from the nose, the stomach, the mouth, the medicines, or even the way the throat is being irritated every night while they sleep. But here's what most people miss. The mucus is often not the main problem. The mucus is the message. Your body is not betraying you. It is asking for help. Hello, I'm Dr. Michael Carter, and on this channel we talk about senior health in plain English. This video is educational. It does not replace your own doctor because your medical history, your medications, and your symptoms matter. Let me tell you about Margaret. Margaret was 68 years old. Every morning, before she even got out of bed, she had to clear her throat. Not once, not twice, sometimes 10 or 15 times. She kept a glass of water by the bed. She bought cough drops. She used cough syrup. She avoided cold drinks because someone told her cold drinks caused phlegm. Then she started getting embarrassed because whenever she spoke on the phone, her voice sounded wet and rough. Her daughter finally said, "Mom, you sound sick all the time." But Margaret did not feel sick. She had no fever, no heavy chest infection, no flu, just this annoying, stuck mucus that kept coming back. And this is where the danger begins. Not because every case of throat mucus is dangerous, most are not, but because many seniors either ignore it completely or they start forcing, coughing, and taking random medicines without asking one very important question: where is the irritation coming from? Because if you do not find the source, you can keep chasing the mucus for months. Today, I want to explain this calmly, in plain English. We are going to talk about why mucus gets stuck in the throat after 60, why it may not be a cold, the common hidden causes, what you can safely try at home when you should call a doctor, and what questions to ask so you do not get brushed off. And stay with me, because number 3 surprises most seniors. Before we begin, one important safety note. This video is for education only. It cannot diagnose you. If you have trouble breathing, chest pain, blood in your mucus, severe trouble swallowing, choking, unexplained weight loss, fever that does not improve, or you feel like food is stuck and you cannot swallow, do not wait. Get medical help. Now let's begin. 1. The mucus may be coming from your nose, not your lungs. Many seniors feel mucus in the throat and immediately think, "My chest is full." But very often, the mucus is not coming up from the lungs. It is dripping down from the nose and sinuses. This is commonly called postnasal drip. Here is the simple version. Your nose and sinuses are lined with soft tissue that makes mucus. That mucus is not bad. It helps trap dust, germs, pollen, smoke, and other irritants. Most of the time, you swallow it without noticing, but when the lining becomes irritated, swollen, or inflamed, it can produce more mucus. The mucus can become thicker, then it slowly drips down the back of your throat. That is why you may feel a lump in the throat, a need to swallow again and again, a wet feeling at the back of the throat, a cough that is worse when lying down, a voice that sounds rough in the morning, a feeling that you need to clear your throat but nothing comes out. But here's what most people miss. If the mucus is dripping from above, cough syrup alone may not fix it, because cough syrup is aimed at the cough. But the cough may only be the reaction. The real issue may be the nose, sinuses, allergies, dust, dry air, smoke, or pollution. Think of it like water dripping from a ceiling. You can keep mopping the floor, but unless you find the leak, the floor keeps getting wet. Your throat is the floor. Your nose and sinuses may be the leak. Safe first steps may include drinking enough water, using a humidifier if the air is dry, avoiding smoke and strong odors, and asking your pharmacist or doctor about a saltwater nasal rinse if it is safe for you. But do not use medicated nasal sprays for many days without guidance, especially decongestant sprays. Some can make congestion worse if overused. The mistake is not the symptom. The mistake is forcing it. If you keep coughing hard all day to clear mucus that is dripping from your nose, you may irritate your throat even more. Then the throat makes you want to clear it again. That becomes a loop. Mucus irritates the throat. You clear the throat. Clearing irritates the throat. The throat feels worse. You clear it again. So instead of forcing it, try this gentle approach. Take a sip of water. Swallow slowly. Breathe through your nose if you can. Avoid harsh coughing unless you truly need to cough. Notice if symptoms are worse in the morning, after dust exposure, after going outside, or during allergy seasons. That pattern matters. 2. It may be silent reflux, even if you do not have heartburn. Now this one is important. Many people think acid reflux always means burning in the chest, but after 60, some people can have throat irritation from reflux without obvious heartburn. This is often called silent reflux or throat reflux. It can feel like mucus stuck in the throat, a lump sensation, morning throat clearing, hoarse voice, dry cough, sour or bitter taste sometimes, a feeling that the throat is coated, coughing more after lying down. Don't panic, but don't ignore it. The reason this surprises seniors is simple. The throat is sensitive. It does not take much irritation to make it feel swollen, coated, or full of mucus. When stomach contents come upward, especially after late meals or lying flat, the throat can become irritated. Your body may respond by making more mucus or by giving you the urge to clear the throat. And here is the hidden twist. You may not feel acid. You may only feel mucus. This is why some people buy cough syrup again and again, but nothing changes. The cough was not the root. The throat irritation was. Safe first steps that may help some people include: avoid eating large meals close to bedtime. Give your stomach a few hours before lying down. Avoid very spicy, greasy, or acidic foods at night if they trigger you. Reduce late-night tea, coffee, chocolate, peppermint, or heavy fried foods if they worsen symptoms. Raise the head of the bed slightly if your doctor says it is safe. Avoid lying flat right after eating. But please, listen carefully. Do not start taking acid medicines long-term without talking to a healthcare professional, especially if you are already on multiple medications. Some medicines are helpful for the right person, but the cause should be properly checked. You are not being difficult. You are protecting your health. Ask your doctor, could this be silent reflux? Could reflux be irritating my throat even without heartburn? Should I see an ear, nose, and throat doctor? Are any of my medicines making reflux worse? Do I need testing, or should we try lifestyle changes first? That kind of question changes the conversation. 3. Dry mouth can make mucus feel thicker. Stay with me because number 3 surprises most seniors. Sometimes the mucus is not actually increasing much. Sometimes the mouth and throat are too dry, so normal mucus feels thick, sticky, and stuck. This is very common after 60, but dry mouth should not be dismissed as just aging. Dry mouth can happen because of medicines, dehydration, mouth breathing at night, diabetes, certain autoimmune conditions, cancer treatments, or other health issues. And many seniors are on more than one medication. Blood pressure medicines, bladder medicines, depression or anxiety medicines, allergy medicines, sleep medicines, and some pain medicines may contribute to dryness in some people. This does not mean you should stop your medicines. Please do not do that. But it does mean you should ask, could one of my medicines be drying my mouth or throat? Can we adjust the timing? Is there a safer alternative? Should I see a dentist because my mouth is dry? Could dry mouth be affecting my swallowing? Here is why dry mouth matters. Saliva is not just water. It helps you chew, swallow, speak, protect your teeth, and keep the mouth comfortable. When saliva is low, the throat may feel sticky. Mucus may feel like glue. Pills may feel harder to swallow. The voice may become rough. The mouth may burn or feel coated. Safe home steps can include sip water regularly. Use a humidifier at night if the air is dry. Avoid tobacco and alcohol. Limit too much caffeine if it dries you out. Try sugar-free gum or sugar-free lozenges if safe for your teeth and swallowing. Keep regular dental checkups. Ask your doctor or dentist about saliva substitutes if dryness is persistent. But if you are waking up choking, gasping, or breathing through your mouth all night, mention sleep apnea to your doctor. Mouth breathing can dry the throat, but the reason for mouth breathing also matters. Your body is not betraying you. It is asking for help. 4. Allergies and irritants can keep your throat in alarm mode. Another common cause is irritation from the environment. Dust, pollen, mold, pet dander, cigarette smoke, cooking smoke, strong perfumes, cleaning sprays, cold, dry air, pollution. After 60, the throat may become less forgiving. If you already have reflux, dry mouth, or sinus drainage, one extra irritant can push the throat over the edge. This is why some seniors say, "I am fine at home, but worse outside. I am worse when the windows are open. I am worse after cleaning. I am worse around smoke. I am worse in winter when the room is dry. I am worse after sleeping under a fan." The mucus is not always infection. Sometimes it is irritation. And irritation can create a protective response. The body makes mucus to trap and move irritants away. That mucus then sits in the throat, and you feel like something is stuck. The practical step is to become a detective. For 1 week, write down when is the mucus worst, morning or evening, after meals or after lying down, after going outside, after cleaning, after drinking coffee or tea, after certain foods, after taking a medication, after sleeping with a fan or air conditioner. Do you also sneeze, itch, or have watery eyes? Do you also have heartburn, burping, or sour taste? Do you also have dry mouth? This little list can help your doctor much more than simply saying, "I have mucus," because the pattern points to the cause. And if you are a caregiver watching a parent clear their throat all day, do not shame them. Do not say, "Stop doing that." They may not be doing it on purpose. Instead, say, "Let's write down when it happens," and ask the doctor what may be irritating your throat. That is protective. That is respectful. 5. Swallowing problems can hide behind mucus stuck. Now we need to talk about a serious point calmly. Sometimes a person says, "I have mucus stuck in my throat," but what they are actually feeling is trouble swallowing. This matters especially after 60. Swallowing is not simple. It involves the mouth, tongue, throat muscles, nerves, voice box, and esophagus. Everything must coordinate quickly so food and liquid go down the right way. If swallowing becomes weaker or less coordinated, a senior may feel food sticking, pills sticking, coughing during meals, choking on liquids, a wet voice after drinking, drooling, weight loss, avoiding certain foods, taking longer to eat, repeated chest infections, fear of eating alone. This is where the danger begins, because swallowing trouble can increase the risk of choking, poor nutrition, dehydration, or food and liquid going toward the airway. Do not panic, but do not ignore it. If you often feel food gets stuck, if swallowing takes effort, if you cough while eating, if pills are hard to swallow, or if you are losing weight without trying, you need medical evaluation. This may involve your primary doctor, an ear, nose, throat specialist, a gastroenterologist, dentist, or a speech-language pathologist who evaluates swallowing. And please remember this: do not assume every lump feeling is cancer. Many causes are not cancer, but do not ignore persistent symptoms either. A calm check is better than months of fear. You are not being difficult. You are protecting your health. 6. Medicines can quietly create the problem. Now let's talk about something many seniors are not told clearly enough. Sometimes the throat mucus problem is not one disease. It is the combination of several small factors, and medicines may be part of the picture. One medicine may dry the mouth, another may worsen reflux, another may thicken secretions, another may make you sleepy, so you breathe through your mouth at night, another may make swallowing feel slower, and because each medicine was prescribed for a reason, nobody connects the dots. This is why you should never stop medicines on your own. but you should absolutely ask for a medication review. Here are questions to ask. Which of my medicines can cause dry mouth? Which can worsen reflux? Could any of them make mucus feel thicker? Could timing my medicines differently help? Do I still need all of these? Are any over-the-counter allergy or sleep medicines making this worse? Can my pharmacist review this with me? Many seniors forget to mention over-the-counter medicines, but allergy pills, sleep aids, cold medicines, and decongestants can matter. Also mention supplements, mention herbal products, mention sprays, mention lozenges, mention everything. The doctor cannot protect you from a medicine they do not know you are taking. But here's what most people miss. The goal is not to blame medication. The goal is to see the full picture. Sometimes changing one medicine, adjusting one habit, and adding moisture at night can make a big difference. 7. What to do first at home. Safely. Now, let's make this practical. If your throat mucus is mild, you can breathe normally. You are not choking. You are not losing weight. There is no blood, no severe pain, and it has not been going on for a long time. There are safe steps you can try. First, hydrate gently. Do not force huge amounts of water all at once, especially if your doctor has restricted fluids because of heart failure, kidney disease, or another condition. But if you are allowed to drink normally, sip water through the day. Second, use moisture. A humidifier at night may help if your room is dry. Keep it clean because a dirty humidifier can make breathing symptoms worse. Third, try gentle throat care. Instead of harsh throat clearing, take a sip of water and swallow. Some people find warm drinks soothing. Others prefer cool water. Use what feels safe and comfortable. Fourth, consider salt water gargling if safe for you. Do not swallow the salt water. Gargle gently. Stop if it irritates you. Fifth, consider saline nasal rinse or spray. Saltwater nasal rinses can help some people with nasal mucus. Use clean or properly boiled and cooled water according to product instructions. If you are unsure, ask a pharmacist. Sixth, look at your evening routine. Do you eat late? Lie down soon after dinner? Drink caffeine late? Sleep flat? Wake up with sour taste? These clues may point toward reflux. Seventh, reduce irritants. Avoid smoke, strong fragrances, harsh cleaning sprays, and dusty rooms when possible. Eighth, review your medicines. Do this with your doctor or pharmacist. Do not stop them alone. Ninth, protect your teeth and mouth. If your mouth is dry, see your dentist. Dry mouth can increase dental problems. It is not just a comfort issue. And 10th, track the pattern. Morning mucus suggests night dryness, reflux, or postnasal drip. Mucus after meals may suggest reflux or swallowing issues. Mucus with sneezing may suggest allergies. Mucus with fever may suggest infection. Mucus with trouble swallowing needs evaluation. This is how you stop guessing. Please listen carefully. Call your doctor or seek medical help. If symptoms last more than a few weeks, you develop trouble swallowing, food or pills feel stuck, you cough or choke while eating, your voice stays hoarse, you have blood in mucus, you have unexplained weight loss, you have fever that does not improve, you have chest pain, you have shortness of breath, you have severe throat pain, you have repeated vomiting or regurgitation, you have a lump in the neck, you keep getting chest infections, you feel weak, dehydrated, or confused, and get emergency help if you cannot breathe, cannot swallow, or feel that food is stuck and blocking your throat. Don't panic, but don't ignore it. Early help is not a weakness, it is wisdom. Questions to ask your doctor. Here are the exact questions you can write down. Could this be postnasal drip? Could this be silent reflux? Could dry mouth be making the mucus feel thick? Could any of my medicines be causing dryness or throat irritation? Do I need to see an ENT doctor? Do I need a swallowing evaluation? Should I see a dentist for dry mouth? Are there red flags in my case? What should I try safely at home? When should I come back if it does not improve? These questions are powerful because they move the visit from "I have mucus" to "let's find the cause." You are not being difficult. You are protecting your health. If you are over 60 and dealing with mucus stuck in your throat, I want you to hear this clearly. You are not disgusting. You are not annoying. You are not imagining it. And you do not need to keep forcing your throat until it hurts. Your body may be telling you something simple. I am dry. I am irritated. I am reacting to reflux. My nose is dripping. My medicines need review. My swallowing needs checking. The mucus is not always the enemy. Sometimes it is the clue. So today, start gently. Drink water if you are allowed. Add moisture if the air is dry. Avoid smoke and strong irritants. Notice if it happens after meals or lying down. Do not overuse random medicines. And if it lasts, changes, or comes with red flags, please talk to a healthcare professional. Your body is not betraying you. It is asking for help. If this video helped you understand what may be happening, subscribe for more calm, practical health explanations for seniors. Share this with someone who keeps clearing their throat every morning but thinks it is just age. And in the comments, write, "I will check the cause, not force the symptom." That one sentence may remind someone else to protect their health too. Pinned comment style. Summary. Mucus, stuck in throat after 60? It may not be a cold. Common hidden causes: postnasal drip, silent reflux, dry mouth allergies or irritants, swallowing problems, medication, side effects. Safe first steps: sip water, use moisture, avoid smoke/irritants, consider saline rinse, avoid late heavy meals, track when symptoms happen, and review medicines with your doctor or pharmacist. See a doctor if it lasts more than a few weeks, or if you have trouble swallowing, choking, blood, fever, chest pain, breathing trouble, hoarseness, weight loss, or food/pills getting stuck. Don't panic, but don't ignore it.